Hello guys, I hope you're all doing really well. The topic for today's video is the ultrasound features of a dermoid cyst. Now first let's talk about what is a dermoid cyst. A dermoid cyst, also known as the benign cystic teratoma, is an ovarian germ cell tumor composed of mature epithelial elements. So it contains tissues normally found in the skin such as oil, sweat glands, hair and teeth. A dermoid cyst is present at birth but may not be discovered until later in life. They are bilateral in 10 to 25% of the cases. There are certain characteristic ultrasound features of a dermoid cyst that help in its diagnosis. These include a dermoid plug. It is a common feature of dermoid cysts. This appears as an echogenic mass within the cyst that's made up of fat, hair, or teeth. A dermoid mesh, a mesh-like pattern of multiple small hyperechoic lines and dots within the cyst. Tip of the iceberg sign, a hyperechoic area that appears without its base being visible. Fat fluid level, also known as a hair fluid level or fluid level. Sac of marble appearance, globules of fat floating in the cyst's lumen that can produce this appearance. Echogenic stripes that are multiple and thin, calcified components within the mass. Echogenic interface, it is an interface at the edge of the mass that obscures deeper structures. Hair strands, these are linear and punctate echos. These are called the dermoid mesh or sparkling lines. Let us review a few pictures from the book Requisites of Ultrasound of a dermoid cyst. In this image, you can see that there is a dermoid of the right ovary. It has both cystic and solid elements. The solid element is echogenic, indicated by the white arrow, and the cystic element is immediately adjacent to the solid element, indicated by the black arrow. The solid component, which is highly echogenic, is the dermoid plug. In this image of a dermoid cyst, you can see multiple dermoid plugs indicated by the arrows. These are highly echogenic structures. Now in this image of a dermoid cyst, you can see the tip of the iceberg sign. As you can see, the dermoid is indicated by the white arrows, but the deeper structure of the dermoid is not visible due to the attenuation of the sound waves. This is another image of the dermoid cyst, and it shows what is called the dermoid mesh. In this, there are interlacing hyperechoic linear and punctate echoes indicated by the arrows, and it basically corresponds to the hair strands in the dermoid cyst. Now this is another image of the dermoid mesh, and you can see that there is no internal blood flow in the dermoid mesh. In this transabdominal image of a large dermoid cyst, you can see calcification indicated by the long arrow with posterior shadowing. There is also non-shadowing, highly echogenic posterior fluid level indicated by the short arrow, and an anterior fluid component which is indicated by the arrowhead corresponding to the sebum. In this transvaginal image of a dermoid, you can see fat fluid level indicated by the short arrows. Now in this image of a dermoid, you can see floating fat globules indicated by the short arrows. So this sums up my video for today. Please subscribe to my channel and like this video, and inshallah I'll come up with more such interesting content. Thank you.